Did you know something as simple as an imbalance in your copper could be the key to understanding your depression, especially if you're a woman? If you're somebody who's been suffering or feeling stuck, this video might just offer the breakthrough that you need. For 1 in 5 people, this is probably the primary driver of the depression that most people are struggling with. I'm going to go through 7 slides from a seminar that I teach on mental health and nutrition, and hopefully connect these dots for you and help you understand whether or not this is specific for you. Let's start with just this first slide right here. I'm going to play from the current slide about its connection to norepinephrine. So when we're talking about mental health, dopamine is something we hear an awful lot about. This is a powerful book that I think everybody should actually take a look at when they get a chance. It's called Nutrient Power, Dr. William J. Walsh. He has worked with over 30,000 patients with conditions ranging from autism to schizophrenia. And after he looked at 30,000 people, millions of labs, he found some very interesting information and percentages of how many people this can be the issue. Too much copper over converting dopamine into norepinephrine. Now, that's not the only piece of it, but this is a major piece of it. Now, before you run out and grab something a supplement to help you with this, I do want to point out that it's very important to understand the type of copper and where people are getting it from. They may be getting it from supplements to begin with. This copper sulfate that you see here is an inorganic compound, and that can be more detrimental to your health than helpful to your health. And in fact, copper sulfate's been registered for use in pesticide products since 1956. This is why I always talk about the importance of getting your nutrients from a whole food product. The difference being food copper, organic copper, is processed by the liver and transported and sequestered in a safe manner. Where inorganic copper, such as that, it could be in drinking water or synthetic copper supplements, oftentimes things like copper IUDs, largely bypass the liver and enter the free copper pool of the blood directly. And this copper is potentially toxic because it may penetrate the blood-brain barrier. This is from an excerpt from George W. Brewer, MD's research, and it was highlighted by Dan Murphy, DC. So here are some of the things that contribute to it. It could be birth control. It could be synthetic supplements that we just looked at. It could be low stomach acid, which is very common in a whole other section. It could be a zinc deficiency, but it could also be a lack of a gallbladder or a congested gallbladder, which is very, very common. And I do a whole other section on that, or even cooking in copper plumbing. But this is what I want everybody to see here. In the book, he highlights that about 17% of depression patients exhibited high copper as their dominant chemical imbalance, and the vast majority of the people with this biotype are women, with the first episode of depression typically occurring during a hormonal event such as puberty, childbirth, or menopause. So I want you to think about anybody who's ever struggled with postpartum depression, or a depression that was consistent with hormonal changes. Copper overloaded people with depression usually report that SSRIs, serotonin enhancing antidepressants, do provide improvements, but they worsen anxiety. And also, high copper females are usually intolerant to birth control. So if you've had a history of that, that may be a clue. Or hormone replacement therapy, since these treatments increase copper levels in the blood. So let me just go through a really quick case study that he talks about in here. This is a female who had increased depression after her pregnancies and was feeling even suicidal after her third child. She reported minor stresses brought her to tears. She had 2 years of counseling plus psychiatric meds that failed to provide benefits. And what Dr. Walsh did is he looked at some of her history, then he checked her copper levels, which we can do, and you can do that very easily. And he showed that her copper levels were way above the normal range, and her zinc levels were way below. There's a big balance between the two. But after 6 months of helping balance her nutrients, the metal levels were normalized and her depression was gone. And I want this for all of you out there who may be struggling with this as the reason. It's very easy to get these labs tested, and you can do that. I tested my own. These are my own results. I have other examples in here in this book, but this is the piece that I want to show. No matter what Dr. Walsh found as a driver of the depression, zinc was in every protocol, because he did find that most people with elevated blood copper also did exhibit depressed zinc and oxidative stress. And after 35 years of research, 3 million blood, urine, and tissue chemistries from 30,000 people, He found that zinc deficiency was by far the most frequently observed chemical imbalance in mental health populations. Over 90% of the people diagnosed with depression, behavior disorders, ADHD, autism, schizophrenia, all exhibited depleted plasma zinc levels. That's low to normal. So what am I saying here? Perhaps if you can understand your zinc and copper balance, that could be the key to you getting back to feeling like your best self. And the thing is that the rest of your body is going to thank you too, because it needs that balance for all these different things in your body to keep you healthy long term. Back to the original, though, I don't want you to just run out and grab a zinc supplement and take that, because the inorganic forms are not the best. You do want to make sure that you are working with somebody who really understands nutrition. But I will tell you this: good whole food sources would be things like pumpkin seeds, pecans, oysters. Now, these nuts and seeds, though, do need to be raw, organic, and sprouted to be best. Not saying that's just going to be enough to bring balance to that. That's why you want to work with somebody. But before you jump in and just grab a zinc supplement, do understand that there is going to be a dance between these two. Find somebody who can help you with that. And maybe this will be the key for you and for the happiness for the rest of your life. Thanks for watching. Hope this video was helpful.